Hey everyone! Welcome back to our channel. It's so good to see you all here again. Today, we're diving into a crucial topic, vitamin B12 deficiency symptoms that you should never ignore. We're talking about those subtle signs your body might be sending you, screaming, "Hey, I need more B12." You see, this vitamin is a VIP in your body, playing a key role in everything from energy production to nerve function. Now, you might be thinking, how common is B12 deficiency anyway? Well, it's more common than you might think, especially as we age or if we have certain dietary habits. That's why it's so important to be aware of the signs and symptoms so you can catch it early and get the treatment you need. In this video, we're going to break down 7 of the most common symptoms of vitamin B12 deficiency. We'll talk about why these symptoms occur and what you can do to address them. So, stay tuned because this information could seriously impact your health and well-being. Before we jump into the symptoms, let's take a quick second to understand why vitamin B12 is so important. Think of B12 as a vital cog in your body's intricate machinery. It's essential for a whole bunch of functions, but one of its most crucial roles is in the formation of red blood cells. Now, these little guys are like the delivery trucks of your body, carrying oxygen from your lungs to every single cell. Without enough B12, your body can't produce enough red blood cells, leading to a condition called anemia, which we'll talk more about later. But B12 doesn't stop there. It's also a key player in keeping your nervous system functioning like a well-oiled machine. It helps maintain the protective covering around your nerves, called the myelin sheath, which is crucial for transmitting nerve impulses efficiently. And if that wasn't enough, B12 is also involved in DNA synthesis, the process of creating and repairing your body's genetic blueprint. So, as you can see, this vitamin is a bit of an overachiever, and when it's lacking, your body can really feel the impact. Let's talk about one of the most common symptoms of B12 deficiency: fatigue and weakness. We're not talking about your average end-of-the-day tiredness here. We're talking about a persistent lack of energy that just doesn't seem to go away, even after a good night's sleep. Remember how we talked about B12's role in red blood cell production? Well, when you're deficient in B12, your red blood cell count takes a hit. And since these cells are responsible for carrying oxygen throughout your body, fewer red blood cells mean less oxygen reaching your tissues and organs. And guess what happens when your cells don't get enough oxygen? You guessed it. They can't function at their best, leaving you feeling drained and wiped out. So, if you're constantly feeling like you're running on fumes, even after a full night's rest, it might be time to get your B12 levels checked. Here's something you might not know. Vitamin B12 plays a crucial role in your mental health. That's right, this mighty vitamin has a direct impact on your mood, memory, and overall cognitive function. So, when B12 levels dip too low, your brain can really feel the effects. One of the most common mental health issues linked to B12 deficiency is depression. While the exact connection is still being studied, researchers believe that B12 deficiency may disrupt the production of certain brain chemicals, like serotonin and dopamine, that play a role in regulating mood. But it's not just depression. B12 deficiency has also been linked to memory problems, difficulty concentrating, and even more serious cognitive decline like dementia. That's because B12 is crucial for maintaining the health of your nerves, including those in your brain. Ever experienced that pins and needles sensation in your hands or feet? It's like that feeling when your foot falls asleep, but it just doesn't seem to go away. Well, this tingling and numbness, especially if it's persistent, can be a sign of nerve damage. And you guessed it, B12 deficiency is a common culprit. Remember how we talked about B12's role in maintaining the myelin sheath, that protective covering around your nerves? Well, when B12 levels are low, this myelin sheath can become damaged, disrupting the transmission of nerve impulses. This disruption can lead to a whole range of neurological symptoms, including numbness, tingling, and even a burning sensation in your extremities. In some cases, people with severe B12 deficiency might even experience difficulty walking or coordinating their movements. Here's a symptom you might not expect. Balance problems. That's right. B12 deficiency can affect your coordination and balance, making you feel unsteady on your feet. This can make everyday activities like walking, climbing stairs, or even just standing for long periods challenging and even dangerous. But why does this happen? Well, it all goes back to B12's role in maintaining a healthy nervous system. When your nerves aren't functioning properly due to B12 deficiency, it can affect your proprioception, which is your body's ability to sense its position in space. This means your brain doesn't receive accurate information about where your body is, leading to balance issues and coordination problems. So, if you're finding yourself stumbling more often or feeling unsteady on your feet, don't just brush it off. It could be a sign of B12 deficiency. We've talked about how B12 is essential for red blood cell production, but let's dive a little deeper into what happens when you don't have enough of this crucial vitamin. One of the most serious consequences of B12 deficiency is a type of anemia called megaloblastic anemia. Now, anemia simply means you have a lower than normal number of red blood cells circulating in your body. But in megaloblastic anemia, the red blood cells that are produced are abnormally large and don't mature properly. This means they're not as efficient at carrying oxygen throughout your body. As a result, you might experience classic anemia symptoms like fatigue, weakness, shortness of breath, pale skin, and even heart palpitations. Megaloblastic anemia can also lead to other complications if left untreated, so it's crucial to address B12 deficiency early on. Now, this next symptom might sound a little strange, but trust me, it's one you shouldn't ignore. A swollen, inflamed tongue, also known as glossitis, can be a sign of B12 deficiency. It's not the most common symptom, but it's definitely one that can raise a red flag. Glossitis can cause your tongue to become tender, smooth, and even change color. You might experience pain or burning, especially when eating or drinking certain things. It can also make it difficult to chew, swallow, and even speak properly. While there are other potential causes of glossitis, B12 deficiency is a common culprit. That's because B12 plays a role in cell growth and repair, and a deficiency can affect the health of the cells in your tongue. So, there you have it. 7 signs and symptoms of vitamin B12 deficiency that you should never ignore. From fatigue and brain fog to numbness and balance problems, this vitamin deficiency can manifest in some surprising ways. But the good news is, early detection and treatment can make a world of difference. If you're experiencing any of these symptoms, it's important to consult with your healthcare provider. They can run a simple blood test to check your B12 levels and determine if a deficiency is the root cause. Remember, your health is your most valuable asset, so don't hesitate to advocate for yourself and seek the care you need. Thanks for watching, and don't forget to like and subscribe for more health tips.